actions. So the what you say, the elimination or the prevention starts with me always. Then there are several governmental agencies which we need to collaborate with to see that our environment is clean, and all actions are taken to prevent mosquito breeding. And then it comes to the health force, obviously, who has been working in surveillance, in treatment, in control of the disease, tracing contacts, making malaria card for all migrant labor. So there is a lot of work involved. Now the state of Goa is in the elimination phase, and we are expected to eliminate malaria by 2022, which means that the annual parasitic index at the state and the district level is less than 1. Of the 34 peripheral health centers, 25 health centers have achieved zero indigenous cases till 2021. So we have obviously 9 more health centers who need to work to see that we achieve this target. And Dr. Kalpana also will be assisting them, and we hope to eliminate, and I am sure we will, by 2022. There is a steady decline in the malaria cases since 2018 due to the prevention and control measures undertaken by the peripheral health centers, like I said, and the mandatory screening of laborers under the Goa Public Health Act. But this is no reason to be complacent, because always we have seen in history that when we decide that a disease has gone, like in tuberculosis, it has a nasty habit of resurfacing if the measures are there is a slackness in the measures undertaken. So we have to continue beyond this point of elimination to see that it is sustained, and we continue the good work that we have been doing over the years. In the year 2018, Dr. has given me the statistics. Goa had 377 malaria cases, which has declined to 90 cases in the year 2021, and there has been no death since 2018. Obviously, in the last 2 years, we have been preoccupied with the virus circulating among us, but still our efforts towards malaria and the vector-borne diseases somehow have not decreased. The efforts are still going on, and they were going on in the last 2 years also. So there is no resurgence in the cases, thankfully. But like I said, this is no time for slackness. We continue to do our work as we have been doing, and see that this disease is, we achieve elimination. All the vector-borne diseases are notifiable diseases since 1996. Hence, we need cooperation from the private sector in notifying the cases that they are diagnosing. To achieve malaria elimination, like I said, intersectoral coordination is very important, and you continue with your effort of liaising with all the district authorities, which has been made easier now, because during COVID times you have been working quite closely. So we continue with these efforts in the field of malaria also. And I thank Dr. Rufino again for being here in spite of his commitments in the morning, patients and so many other days, and Dr. Mahalwar also. Thank you very much.
थँक्यू मॅडम. आणि नक्कीच तुमच्या मार्गदर्शनाखाला आम्ही मलेरिया एलिमिनेशन हे आम्ही हो गोल आसा तो आम्ही अचीव करतले. If the heat bothers you, plant a tree. If the water bothers you, plant a tree. If you like flowers and fruits, plant a tree. If you like birds, plant a tree. And if you like a life, then plant many trees. So अशी एक मेसेज आशिल्ली जी झाडांचेर आशिल्ली, आणि हे आज मुद्दाम कितें म्हणलेलें आसा की आमच्या आतां मान्यवरांक आसा ते आमी ल्हानशी फुलाची आमी रोपटी हांगा भेटोवपाची आसा. तर म्हाका श्रीमती माधुरी शिरोडकर कडेन की तांणी आमचे मुखेल सोयरे आसा, मानाधीक सोयरे डॉक्टर रुफिनो मेंतोरो हांकां रोप भेटोवपाक. म्हाका श्रीमती जमिरा कोस्टा कडेन की तांणी भलायकी संचालिका मानेस्त डॉक्टर गीता काकोडकर हांकां रोप भेटोवपाक. म्हाका श्रीमती माधवी सावंत कडेन की तांणी आमचे MS डॉक्टर वंदना दुमे हांकां रोप भेटोवपाक. मागता लिओनेटा कडेन की तांणी डॉक्टर रुपा नायक आमचे CMO NCDC हांकां रोप भेटोवपाक. मागता श्रीमती संगीता कडेन की तांणी SPO NUBDCP डॉक्टर कल्पना महात्मे हांकां रोप भेटोवपाक. मागता सानवी कडेन की तांणी ऑफ द डेज आसा ते डॉक्टर अमोल महालदार वायस प्रेसिडेंट ऑफ दिसवाडी तांकां फूल भेटोवपाक. मागता नलिनी कडेन की तांणी NIMचे ऑफिसर इंचार्ज डॉक्टर मोहंती हांकां फुलां भेटोवपाक. मातशें तेणी फुडें येवचें डॉक्टर मोहंती. मागता गोवा कॅन्सर श्री रोलन मार्टीन हांकां फुलां भेटोवपाक. देव बरें करूं तुमकां. तर दीप प्रज्वलन करता तेन्ना आमी शुभम करोति कल्याणम आरोग्यम धनसंपदा हो आमी श्लोक म्हणटा. तर आयज आमी ह्या दिसाच्या निमित्तान गोंय मलेरिया मुक्त करपाची इच्छा शक्ती धरून पुराय समाजाचे कल्याण करूया आनी भलायकीचे धन तांकां भेटोवया. तर मागता पावणे लागीं की तांणी दीप प्रज्वलन करचें.
फोटोग्राफर
देव बरें करूं तुमकां. मागता माधवी कडेन की आमची OSD मॅडम हांगा आसा तांकां फुलां भेटोवचे. डॉक्टर राजनाथ देसाय हांकां. मॅडम मॅडम थँक्यू. तर मलेरिया वांगडाच डेंग्यू, चिकुनगुनिया, फायलेरिया, जपानीज एन्सेफेलायटीस ह्या सारख्या रोगाचे नियंत्रण हाडपाचें काम नॅशनल व्हेक्टरबोर्न डिजीज कंट्रोल प्रोग्राम हो विभाग करता. आणि हे सगळे कार्य आमच्या भलायकी संचालिकाच्या मार्गदर्शनाखाला स्टेट प्रोग्राम ऑफिसर डॉक्टर कल्पना महात्मे यशस्वीरित्या करीत आसा. तशेंच आयज तुम्ही ही सुंदरशी कार्यावळ पळयता ती सुद्धा त्यांच्या अथक प्रयत्नाचे फळ जावन आसा. तर म्हाका त्यांचे विभागाचे कार्य आणि उपलब्धी आणि वर्ल्ड मलेरिया डे ह्याच्या बद्दल आमकां माहिती दिवपाक.
Respected chief guest of today's function, Dr. Rufin Montero, our director, Dr. Geeta Kapurkar, Deputy Director, Dr. Vandana Thumi, and Chief Medical Officer, Dr. Rupa, and all my dear friends and colleagues and the prize winners of these poster competitions. for this year is harness innovation to reduce the malaria disease burden and save lives. World Malaria Day was established on May 2007 by the 60th session of the World Health Assembly, WHO decision-making body. It is an occasion to highlight the need for continued investment and sustained commitment for malaria prevention and control. World Malaria Day presents an opportunity to engage civil society, private sector, community leaders, academic institutions, and general public to work for elimination of malaria. Malaria is a life-threatening disease caused by parasites that are transmitted to the bites of infected female Anopheles mosquito. It is preventable and curable. WHO reports estimated 227 million cases in 2019 as compared to 241 million cases in 2020 as per World Malaria Report 2021. In 2020, the African region was home to 95% of all malaria cases and 96% of deaths. Children under 5 years of age accounted for about 80% of all malaria deaths in the region. Since 2015, 9 countries have been certified by the WHO Director General as malaria-free countries. In 2015, Maldives, 2016, Sri Lanka and Kyrgyzstan, 2018, Paraguay and Uzbekistan, 2019, Argentina and Algeria, and 2021, China and El Salvador. These are the new additions. Malaria situation in India. Malaria cases in the year 2016 were 20,87,285, which came down to 1,86,532 in the year 2020. Deaths in 2016 were 331, which came down to 93 in 2020. The malaria cases too in Goa is showing a decreasing trend from 742 cases in 2016 to 90 cases in 2021 and no death since 2018. The malaria cases show a trend of peaking during the monsoon seasons, that is from June to September. In the last 2 years, 2021, high peaks are not seen, maybe due to the proactive preventive measures. But after rains, when the construction activity starts, there is a slight rise. Malaria prevalent areas of 2021 are Panjim, Kandolim, Kortalim, Kasarwane and Margam. These are the areas where there are mega construction projects and also construction activities in full swing. Malaria in Goa is a migrant malaria directly related to the influx from endemic states. Even a local indigenous case can be traced to a construction in the vicinity. Health cards to all the workers at a construction site is mandatory as per Goa Public Health Act. It is seen that when screening of laborers are undertaken within 24 to 48 hours for health cards, cases come down as transmission is curtailed. Now I shall speak about a malaria elimination which the state of Goa has to achieve. Malaria elimination is the interruption of local transmission, reduction to zero incidence of indigenous cases of a specified malaria parasite species in a defined geographical area and zero deaths due to malaria as a result of deliberate activities. Continued measures are required to prevent re-establishment of transmission. Goa is targeting malaria elimination by 2022-23. India to achieve malaria elimination by 2030. So all the states in the elimination phase have to sustain it till 2030. There are various indicators like APR, annual blood examination rate, SPR, slight positivity rate, and API, annual parasitic incidence. Government of India has chosen API to monitor and categorize the states. Categorization based on API, Category 0, prevention of re-establishment phase. None of the states are in this category. Category 1 elimination phase. In this there are 15 states where the state as well as the district API is less than 1. Goa is in this category. Category 2 pre-elimination phase. In this the API of the state is less than 1 but some of its districts have API more than 1. And category 3 is the intensified control phase. There are 10 states and UTs in this category where the API of the state as well as the district is more than 1. These are the 15 states and UTs who are in the elimination phase. The state of Goa was the only state from the elimination category who was invited to present its data and involved in the high-level consultation on drafting National Strategic Plan for Malaria Elimination and to identify the challenges and way forward for malaria elimination in India, held at Delhi on Feb 28, 2022. The suggestions and inputs by the state of Goa were noted for further action by Government of India. District-wise API. We will note that there is a gradual reduction in the API since 2017. In 2017, the API of the state was 0.42, which came down to 0.24 in 2018. In 19, it came down to 0.17, 2020 0.07, and 2021 0.06. Goa has 33 PHCs, CHCs, urban health centers. Of these, 16 peripheral health centers are in north and 17 peripheral health centers are in the south. This year, one more PHC has been added, that is PHC Saligaon. In the year 2021, 25 health centers, 10 in North Goa and 15 in South Goa, have achieved zero indigenous transmission for malaria. Presently, there are 7 high-risk areas for malaria, that is Panjim, Parvarim, Kandolim, Chimbel, Sholim, Margam and Kortalim. In 2020, total 25 health centers, 10 in the north and 14 in the south, have achieved zero indigenous transmission, while in 2021, 25 peripheral health centers, 10 in the north and 15 in the south, have achieved zero indigenous transmission. This is the data of API of various health centers from 2017 to 2021. In South Goa, you may see in the data that only 2 centers have to achieve zero API, that is Madgaon and Kortalim, whereas in the north, Panji, Kandolim, Kasarvane, Porvorim and Pernam have to bring API to zero. The health centers have to achieve zero API have major constructions in full swing with lot of influx. The malaria statistic is very dynamic, depends upon the influx of labor. As per Government of India guidelines, each state have to stratify from PHC to sub-center to village level for better monitoring and achieving elimination. In 2018, there were 9 sub-centers who have API more than 1. In 2019, it came down to 5 sub-centers. 2020, 3 sub-centers, and in 2021, 2 sub-centers. So this year we need to work towards bringing API of these 2 sub-centers to below 1 or 0. Our sensitive zones or the hot spots are major construction sites, migrant settlements in the peri-urban areas, tourism sheds, industrial units and fishing jetties. Hence, our preventive and control measures are focused here in these areas. Goa is committed for micro-level surveillance under which each and every reported case is thoroughly investigated. Specific action, including improved case-based surveillance, is initiated with private sector and community engagement. Regular programs are reviews are held at DHS. Factors that could reverse the gains achieved are ever-changing pattern and emergence of mosquito resistance to affordable chemicals, parasite resistance to affordable and safe antimalarials, change in environmental and climatic condition, human behavior that promote breeding of mosquito. The challenges ahead for us are: there is a hidden sea of asymptomatic malaria carriers amongst the laborers coming from high endemic area, which may remain undiagnosed during the screening for health cards, resulting in transmission of malaria. For SNP and RDT to come positive, at least 50 parasite per cubic millimeter of blood should be there. If any less than that, then it will come negative. Second is the absence of any process documentation of mega projects in the initial stages of planned preventive strategies to be implemented. Tracing and tracking of the labor. Goa being a small state, contractors move their workers at other sites from north to south, hence tracing is an issue. New areas and focus villages. Earlier laborer along with their families used to reside at the construction sites, but now they stay in rental places close to the construction site in peri-urban areas close by villages, leading to new focus. Also, being an epidemic prone disease, real-time reporting with complete address details of the patient, especially from the private sector, is still a challenge, but it is improving to a certain extent. The innovations which Goa state has done is a unit of microplanning. Each PHC, CHC, urban health center in the state is a reporting unit. 33 health facilities, now 34, having its own unique action plan in place with a facility appropriate strategies for prevention and control of malaria, along with stratification of malaria foci down to the sub-center of village level. Health officer, medical officer in charge of the respective health facilities responsible for mapping of the area, planning and execution of malaria elimination strategies in their respective areas of jurisdiction, with support and guidance from the state and WEBTV DHS Goa. Microplan has line listing of constructions, abandoned constructions, graveyards, gulakars, stone quarries, migrant settlement area, jetties, IDC, and this is updated quarterly and action plan prepared accordingly. The documents for malaria elimination are available with each health center in the same alphabetical order for better supervision. That is, A is annual microplan, B line listing of construction sub-center wise with its inbuilt components to be updated quarterly, ongoing as well as abandoned. C is the list of nodal person identified for schools, institute, government building, housing society. D health card registers. E fogging register, anti-larval registers. Case investigation form of each and every malaria case along with the action taken report for each case. G is the list of private practitioners, lab, private hospital from their jurisdiction, how many are reporting and number of cases reported. And H is the line listing of malaria patients, indigenous and imported. This system of microplan, when presented for the review meeting with Government of India, it was highly appreciated. All imported cases from another innovations, all imported cases from peripheral health centers are informed on the email malariaeliminationgoa@gmail.com with all the relevant details to WEBTV DHS by peripheral health centers. All such imported cases are cross-notified to the concerned state program officer of the respective state with a copy to the director and WEBTV Goa, so that the concerned SPO of that state can initiate preventive measure and control transmission. This too was applauded by Government of India during review meeting and was suggested to other states to implement the same, as it would go a long way in malaria elimination. LLI's long-lasting insecticide-treated nets are distributed to all the construction workers at the sites, also covering high-risk population in the community, such as antenatal, migrant hubs, BPL population in the high-risk area, free of cost. And WEBTV has undertaken a research project in association with NIMR, National Institute of Malaria Research, to support malaria elimination program. First is the vector binomics. This will give information regarding seasonal and relative abundance of malaria vector, breeding habitat, biting habitat, human feeding behavior, resting behavior, infectivity rate, and susceptibility to currently used insecticide. This information will be useful in understanding the impact of existing interventions on disease transmission and to design appropriate vector control strategy. The second study is study on asymptomatic and low density malaria parasite infection in the community and its transmission potential in Goa. In this study, the blood samples by NIMR will be tested by PCR, which can detect even 5 malarial parasites in the blood. Hence, our challenge of missing out on asymptomatic carriers will be taken care of and transmission curtailed. Community behavior and its determinants in relation to malaria prevention and control. This is the third study. This will tell us whether the methods of IEC undertaken at present is sufficient to create awareness or there are some gaps which need to be plugged. Research study in the pipeline in association with NIMR, Goa University and BEATS Goa is the development of mobile app for real-time capturing and monitoring of malaria cases among migrant laborers in Goa. All these above studies will be funded by MIRA, Malaria Elimination Research Analysis wing of ICMR. The advantage of this mobile app, the mobile app based tool will be beneficial for real-time reporting, tracking, monitoring and assisting timely monitoring of the imported cases in the state of Goa. Genotyping of parasite and also drug resistance will be undertaken on the patient's blood samples, so timely action to control the spread of drug resistant parasite can be undertaken. Also, it will improve case management and timely vector intervention. The state program officer and WEBTV will be the administrative controller. Contractor will be the point of implementation. PHC Urban Health Center will be the monitoring point. State NIMR Goa University Laboratory will be responsible for genomic stain. In this research study, what is going to happen is the contractor of the study area. The study areas are 4 areas: Urban Health Center Margaon, Panjim, PHC Kandolim and PHC Kortalim will be trained regarding the installation and working of the app. The contractor will install the app in the worker's mobile phone and immediately details will be available to the state program officer and WEBTV and the in charges of the above health centers. Next year, team from the health center and the personnel from NIMR research study will visit the site and the health center staff will take blood samples for blood smear, while RDT and blood sample for PCR will be taken by the research study personnel. PCR will be done to rule out asymptomatic low density carriers. In case laborer is malaria positive, then NIMR and Goa University Laboratory will conduct genome typing and check for drug resistance. This study, after the study is over, we can scale it up to other health centers. Vaccine. WHO recommends extensive use of world's first malaria vaccine for children in sub-Saharan Africa. The vaccine significantly reduces life-threatening severe malaria and it is a cost-effective. Schedule of doses is 4 doses in children from 5 months of age for reducing malaria burden. Its doses have negative impact on other vaccines. According to WHO, the vaccine is a result of 30 years of research and development by British pharmaceutical company GlaxoSmithKline (GSK) in partnership with PATH Program for Appropriate Technology in Health. Since 2019, more than 2.3 million doses of vaccines have been administered to the children in pilot countries like Ghana, Kenya and Malawi. Now, last but not the least, intersectoral coordination is very important. Health alone will not be able to achieve and sustain malaria elimination without support from other departments like DME, Panchayat, PWD, WRD, TCP, Director of Information, Directorate of Education, Labor, Captain of Ports, Director of Industries, NIMR. NIMR we are already associated with and we are having research studies program with them. IME. I shall take this opportunity to request our chief guest for cooperation regarding private sector notification of vector-borne diseases NGO Goa can Dr. Roland Martins, a partner in the prevention and control of BPDs. Thank you very much for patient listening.
थँक्यू मॅडम. तर आता मी फुडल्या सातेर वयता. तर सायकलीचो टायर आणि आटो म्हणजे व्हील तेचो बरो जर उरतलो जाल्यार गरज आसा ती म्हणल्यार तेज्यो सगळ्यो ज्यो रायो आसा, स्पोक्स आसा, ते सारखे सदृढ आसपाचे. तर आमच्या NVBDCPच्या ह्या विभागान काम करपी प्रत्येक कर्मचारी, अधिकारी आपले बहुमूल्य योगदान दिवन ह्या NVBDCPच्या चक्राक फुडें व्हरत आसा आणि आमच्या थारायल्ल्या उद्देशा कडेन लागीं पावपाचो यत्न करता. पण तितूनसूनच आयज आमी कांय कर्मचारी ज्यांनी मलेरिया एलिमिनेशना खातीर खूब बरें काम केल्लें आसा तांकां आमी सन्मानीत करपाचें आसा, जेणे करून तेंची आनीक उर्बा वाडटली आणि तशेंच इतरांक सुद्दां बरें काम करपाचें प्रोत्साहन मेळटलें. तर सगळ्यात पयलीं फील्ड वर्कर्स ह्या गटान जे आमी प्रायजीस आसा ते सिलेक्ट केल्ले आशिल्ले, तितून थर्ड प्रायज आसा ते टाय जाल्ले आसा, जे अजय गांवकर फ्रॉम UHC पणजी आणि त्याच्या नंतर आनंद कांबळे फ्रॉम PSC कोलवाळे. मागता की तेणी ही सन्मान त्यांचो स्वीकार करपाक आणि आमचे आयज प्रमुख पाहुणे आसा डॉक्टर रुफेन मोंटेरो हांचे कडेन की तांणी ही बक्षिसां दिवपाक तांकां. अजय गांवकर UHC पणजी, त्याच्या नंतर आनंद कांबळे PSC कोलवाळे. मातशें सगळ्यांनी मातशें लागीं रावचें.
फोटोग्राफर
आनंद कांबळे PSC कोलवाळे, मातशें बेगीन येवचें. ओके. अजय गांवकर येऊ ना. ओके. सेकंड प्राइज जाल्ले 900 गावास PSC शिवोलीम, 900 गावास PSC शिवोलीम. आणि त्याच्या नंतर फर्स्ट जी प्लेस फावो जाता ती राजेश नायक फ्रॉम USC मडगांव. फर्स्ट प्राइज राजेश नायक फ्रॉम USC मडगांव. तसोच फुडलो जो गट आशिल्लो तो MPHW और ANM ह्या गटान, तितून थर्ड प्राइज मेळ्ळें आसा श्री दामोदर पागी फ्रॉम PSC कुर्तोलीम. श्री दामोदर पागी PSC कुर्तोलीम. सेकंड प्राइज श्री सिद्धेश गावस PSC बेतकी. आणि फर्स्ट प्लेस फावो जाता श्री प्रमोद कांबळे PSC शिवोलीम. फर्स्ट प्लेस श्री प्रमोद कांबळे PSC शिवोलीम. त्याच्यानंतर फायलेरिया इन्स्पेक्टर ह्या गटान मिंगल फॅल्कॉन फ्रॉम USC वास्को. USC वास्को मिंगल फॅल्कॉन. Then next senior fileria inspector Mr. Anthony Thomas Cruz Borges USC Madgaon. Mr. Anthony USC Madgaon senior fileria inspector. त्याच्यानंतर आमचे एक्सटेन्शन एड्युकेटर ह्या गटान थर्ड प्राइज फावो जाल्ले आसा श्री राजू घाटवळ फ्रॉम प्रायमरी हेल्थ सेंटर बेतकी. राजू घाटवळ. दुसरे बक्षीस श्री मिहिर बोरजेवेकर PSC आल्दोना. दुसरे बक्षीस श्री मिहिर बोरजेवेकर PSC आल्दोना. फर्स्ट प्राइज मेळटा श्रीमती करिश्मा केरकर USC वास्को. श्री करिश्मा केकर USA वास्को. तशेंच आमचे रिटायर्ड स्टाफ जावन आसा श्री Edmund Dias, who retired in March after 38 years of service. He was the first and only level 1 WHO certified laboratory technician. He was instrumental in conducting laboratory technician trainings. He actively contributed during the transmission assessment survey for lymphatic filariasis. The Magda, तर हे जे अवॉर्ड सिलेक्शन आशिल्ले तेचे परीक्षकाचे काम डॉक्टर राजेंद्र बोरकर CMO फॅमिली वेलफेअर, डॉक्टर उत्कर्ष बेतोडकर आणि ॲडव्होकेट पल्लवी मुळगांवकर हांणी केल्ले. तर तांकां देव बरें करूं म्हणटा. तशेंच लोक जागृतायेचे एक भाग म्हणून आमी ऑनलायन पोस्टर कॉम्पिटिशन आयोजीत केल्ले आनी ह्या सर्तीक आमकां जवळ जवळ 90 एंट्रीज मेळ्ळ्यो आनी तितूंतसून बेस्ट 5 पोस्टर्स आमचे श्री विल्फ्रेड गोयस आणि सागर गावडे फ्रॉम गोवा कॉलेज ऑफ आर्ट आणि तशेंच डॉक्टर उत्कर्ष बेतोडकर हांणी सिलेक्ट केल्ले. तर तांकां आतां आमी बक्षिसां भेटयतले. म्हाका आमचे डायरेक्टर डॉक्टर गीता काकोडकर हाचे कडेन की तेणी ही बक्षिसां तांकां दिवची फुडली. 5th प्रायज रुद्राजी बोरकर. तुम्ही हांगा स्क्रिनीचेर त्यांचे पोस्टर्स पळोवं येता. 5th प्रायज रुद्राजी बोरकर. Fourth prize Elizo Fernandez. Fourth prize Elizo Fernandez. Third prize Lenza Silva. Third prize Lenza Silva. Second prize Saisha Divkar. आणि फर्स्ट प्राइज फावो जाल्ले आसा प्रवीण कलंगुटकर. फर्स्ट प्राइज प्रवीण कलंगुटकर. बाकीच्या सगळ्या स्पर्धकांक आमी ई सर्टिफिकेट दितले आणि तशेंच मॅडम म्हणटाले तशें की स्टुडंट्सांच्या मदीं सुद्दां आमी सेपरेट आनी 3 प्राइजीस आमी सिलेक्ट करपाचे आसा ते मागीर आमी प्रोग्रेस करतले. तर प्रत्येक भलायकी केंद्रान जे NVPDCP बद्दल महत्वाची भूमिका पार पाडटात ते आमचे आसा सॅनिटरी इन्स्पेक्टर्स. तर तेंचोय आयज हांगा भोवमान जातलो. तर मागता तेणी दिल्ल्या त्या नांवा प्रमाणे ऑर्डरी प्रमाणे तेणी येवचो. सो फर्स्ट जे आसा ते USC पणजी श्रीमती मॅकली आगेर. So, and their कार्य आसा ते responsible for prompt action in the field of control of malaria in hotel staff. USC म्हापसा श्री उदय V तामणकर. सो तेजे कार्य जे आसा ते कंस्ट्रक्शन साइट विजिट prompt screening of laborer आणि म्हाका दिसता बऱ्यापैकी ते कवी सुद्धा आसा. Then CSC Pendant, Shri Premnath Bandekar. He was responsible for control of malaria cases in Ayush Hospital and spillover in the local area. Shri Premnath Bandekar from CSC Pendant. Then next from PSC Kandolin, Shri Kamlakant Parsekar. Regular construction site visits leading to control of malaria cases. Shri Kamlakant Parsekar from PSC Kandolin. Then Shri Prasad Gawas from PSC Aldona and PSC Sakrin. From He is responsible for prompt screening of construction sites and issuing health cards. Then next, Shri Namdev Gaonkar from PSC Bicholim. Shri Namdev Gaonkar, PSC Bicholim. Proactive screening of influx during sugarcane harvesting, also at construction sites. Shri Namdev Gaonkar, PSC Bicholim. Shri Gajanan Parsekar from CSC Wadhoe. Actively involved in the control of upsurge of dengue last year. So Gajanan Parsekar. From fit and finance also उच्च ट्रैकिंग करता Shri Vinod Haldankar from PSC Medke. Prompt preventive action during dengue upsurge. Shri Vinod Haldankar. Next was Shri Santosh Shetkar from PSC Kasarwane. Shri Santosh Shetkar, PSC Kasarwane. Control of malaria cases at Mopa Airport. Shri Santosh Shetkar. फुडलो भोवमान आसा तो मागता की आमची डॉक्टर वंदना तुमी आसा कितेनी दिवचो. श्री श्रीपाद गावस from PSC Shiolem is instrumental in tracking of informed vector-borne disease cases. Shri Shripad Gawas from PSC Shiolem. Then next is Shri Sudan Vishram Naik from PSC Kolwade. Sudan Vishram Naik. Active surveillance at construction sites. Then next Shri Santosh Gaonkar from PSC Kollen. Shri Santosh Gaonkar, PSC Kollen, is responsible for control of malaria under jurisdiction of his Kollen area. Shri Santosh Gaonkar. Next Shri Anil Kiledar from PSC Porvorim. Shri Anil Kiledar, PSC Porvorim, he is responsible for control of vector-borne diseases in Ramnagar slums and High Court area complex. Next, Shri Kishore Arundekar from PSC Chimbel. Kishore Arundekar from PSC Chimbel. So, he did active surveillance at the construction sites. Next is Shri Ezebio De Silva from USC Madgaon. Regular construction site visit and screening. Next is Shri Dayanand Thakkar from USC Vasco. Dayanand Thakkar from USC Vasco, responsible for the control of dengue upsurge in Vasco. Next is Shri Manoj Yaso Naik from PSC Ponda. He is responsible for control of dengue upsurge last year. So Shri Manoj Yaso Naik from Ponda. Then next is Shri Josephat Elment Dekonda, PSC Madgaon, involved in prevention and control of vector-borne diseases. Magda next जे गोमान आसा ते डॉक्टर रूपा नायक हाणी पेटेचे. So Josephat. So next is Shri Divakar Gopinath Gaus Desai from PSC Shiroda. Shri Divakar Gopinath Gaus Desai, PSC Shiroda, is a very good in tracing cases and prompt action taking. Shri Divakar Gopinath Gaus from PSC Shiroda. Next is Shri Suresh Kushrapagi from PSC Kansauli. We did a construction site visit. Shri Suresh Kushrapagi from PSC Kansauli. Next is Shri Jose Antonio Norona, PSC Kurtorim. Next is Shri Lakshmikant Uttam Pagi from PSC Barli. He is responsible for control of dengue upsurge at Kutbona Jetty. Shri Lakshmikant Uttam Pagi. And next is Shri Pranay Naik from CSC Kanakona. रिस्पॉन्सिबल कंट्रोल ऑफ चिकनगुनिया केसीस एट काणकोणा आनी तेजी खासियत म्हळ्यार सदां खासरे तोंड ओके सर. नेक्स्ट इज श्री गजानन नायक CSC कुडचडे. श्री गजानन नायक CSC कुडचडे. Control of malaria cases during CHC construction. Then Pascal Fernandez, CSC Kursodem, Shri Pascal Fernandez. नेक्स्ट भोवमान आसा ते मागता आमची SDO डॉक्टर कल्पना महात्मे हांणी भेटोवचे. सो श्री वासुदेव नायक फ्रॉम PSC सांगे. He worked to control upsurge of malaria at IDC. वासुदेव नायक PSC सांगे. Then Shri Bhaskar Yadav from PSC Kortale, responsible for active surveillance at all the major construction sites, helping in malaria and dengue control. Shri Bhaskar Yadav from PSC Kortale. Then next is Srimati Loyola Sequeira Vaz from PSC Lotlane. She maintained zero indigenous cases in her jurisdiction. From PSC Lotlane. Next is Shri Jagdeep Bhagat from PSC Chinchini. Jagdeep Bhagat. मागता आमचे प्रमुख सोयऱ्याकडे की ताणें ही भोवमान भेटयचो. श्री जगदीप भगत PSC Chinchini. He maintains zero indigenous status in his area. Then next is Shri Jaykumar Naik from PSC Kepen. He maintains proper record of dengue malaria cases and take a prompt action. So Shri Jaykumar Naik from PSC Kepen. Next is Tulsidas Naik from PSC Naveli. Tulsidas Naik from PSC Naveli. He was instrumental in monitoring of a direct observed treatment in falciparum case who was taking anti-malaria. Then the last Shri Pundalik Desai from CSC Pendem. Pundalik Desai from CSC Pendem he control malaria cases but at a major and mega construction site. Josephat from PSC Madkan. Josephat. सगळ्यांक देव बरें करूं. तर आमचे प्रायज डिस्ट्रिब्युशन हांगा सोंपिल्लें आसा. तर रोखडेच आतां फुडल्या स्वातीन आमी वयतात. तर आयज आमचे मदीं आसात आमचे मुखेल सोयरे मानिस्त डॉक्टर रुफेन मोंटेरो, हू इज अ MD MBBS PG डिप्लोमा कार्डियोलॉजी RCP UK, PG diploma advanced diabetic care RCP UK, physician cardio diabetologist, ex-assistant professor of medicine GMC, is the core secretary of Goa State for Public Health Foundation of India CBDM and president of IMA Goa State 2022. So I request him to please address us on the occasion of World Malaria Day.
Dr. Geeta Kapurkar, the Director of Health Services, Dr. Kalpana Mathme, Dr. Vandana Dume, Dr. Rupa, distinguished guests of the stage, medical officers, health workers, NGOs, and print and other media present here. Today is World Malaria Day. As said earlier, celebrated every day on the 25th of April. mandated by the WHO. And today we are talking on the main topic of harness innovations in order to decrease the malaria burden and save lives. In fact, 45 years back, when we studied medicine, we hardly saw any malaria cases in Goa. And when I became a doctor and passed out 40 years back, the treatment of malaria, what we knew was only from the book. If at all, if the fever was not subsiding, we had to give chloroquine, presumptively that it may be malaria. But we had no actual documented cases. Only after 1997, there was such a upsurge of malaria in the state when the construction activity began in Goa, that suddenly we found ourselves in the midst of a ravaging malaria with all its complications. And it was so fearful for us because we did not have any practical hands-on experience. Let me be very frank. We did not have any practical hands-on experience to treat malaria in those days. But gradually, we have been able to treat the malaria. The deaths have come down. And I am very proud to say that our health services has done a fantastic job. Because it is the neglect of us in the community that leads to all this upsurge. We do not keep our surroundings clean. We allow water to be stagnant. And of course, we want a lot of construction to come up. We want to sell our lands. And then there are a lot of migrant workers. We do not have locals who want to work. And the migrant population is needed to do their jobs. But I would say real kudos to the health services. They have controlled this upsurge very well. Though some more things are to be done, we have to be very strict with the migrant workers. I know that our health workers do come, even when there was an outbreak of dengue, how they used to search where the water is, in the water pots, in other places gathered, see that the water is drained out, come for follow-up. Even certain drains used to be clogged, which even the societies did not know. But they found out the things and they really brought things under control. So, though I've been a practitioner in Panjim, I also visit Khandoli, I visit Parra, my home place Santisteva. So I've seen how the workers everywhere are working, and while complimenting all you health workers, as doctor said in her speech, we should not be complacent. We should not feel that now we have achieved in our area a very good level, hardly any cases, that we can sit back and relax. No, you have to be vigilant. Now that the rains are coming, you will have to see where the water stagnates, and that the pandemic is over, a lot of construction activity has begun to surface again. So those sites have to be monitored. You have to be very strict and to see that those sites are well taken care of by the health cards, by visiting and testing the workers, because 2 or 3 workers there can spread the disease to all the people around, and maybe one of us ourselves may get it. And the complications can be very bad. So please don't put your guard down, dear health workers. Carry on the good work you are doing. And in areas like Panjim, Kandolim, Chimbel, Kasarvane, and other areas where the incidence is still a bit on the higher side, please work extra, because these are preventable diseases. And vector-borne diseases, if controlled, will go a long way in seeing that the health of the population is well maintained, and we go a long way. Of course, we do not, like the African continent, need lot of more innovations. Like now there is gene sequencing. They put genes in the malaria, mosquitoes. There are entosites that are given, being tried, like ivermectin. There are different types of nets that are being tried. But since our incidence is under control with the present measures, we do not really need all those innovative measures. But it's nice to see that a lot of research is being done at various places. The research has to go on, and we have to see that innovations do come, because our youngsters are bright. Our youngsters can work a lot of wonders if they use their brain properly and if we guide them properly. So it's nice to see that a lot of innovations are being done. And with Dr. Geeta Kakodkar, Dr. Kalpana Matme being here in charge, I think vector-borne diseases will come under control very soon with the work that they will be putting in. So thank you very much, Dr. Kalpana and Dr. Geeta, for calling me here to be the chief guest. And whatever is to be done from the private sector, yes, we will be after our private practitioners through the IMA and other forums to see that they report whatever cases they get, so that prompt action can be taken and control of elimination of malaria becomes much simpler. Thank you very much.
थँक्यू सर. सो तुमी सांगिल्ली सगळी उतरां आमकां बरी याद उरतली आनी आमी ती इम्प्लिमेंट करतली अशी आस बाळगिता. तर जे प्रायज विनर्स आसा पोस्टर्स तांकां एकूच सांगपाक सोदता की जे आमी एनवलप दिला ते तितून कांय ना, पूण मागीर आमी तुमचो अकाउंट नंबर तुमी आमकां दिवपाचो. ऑलरेडी तुमकां ईमेल धाडला, मॅडम परतून एकदा सांगूंक शकता. सो ओनली थिंग इज आमी एवरी टायम आमी
ऑलरेडी मेल धाडला तुमकां, तुम्ही ऑलरेडी खूप लोकांनी आपले अकाउंट नंबर धाडला, तो तातूंत ट्रान्सफर जातले.
सो अकाउंट मातशें सगळ्यांनी आपलो अकाउंट नंबर दिवचो. ओके. तर आयच्या सारको दीस फाल्यां येवपाना, आयच्या सारको दीस फाल्यां येवपाना, तुमच्या सारके मानेस्त आमकां सदांच मेळपाना. निमंत्रण स्विकारून हजर रावले तुमी म्हणून तुमचे उपकार आमी केन्नाच विसरपाना. मागता डॉक्टर नंदिनी कोरगांवकर कडेन की तांणी उपकाराची उतरां उलोवपाक.
Respected ladies and gentlemen, a very good day to one and all. It's my honor and privilege to have been asked to propose a vote of thanks on the occasion of the observance of World Malaria Day today, 2022. First and foremost, I thank our distinguished chief guest, Dr. Goan Reporter, President of Goa State IMA, who despite his busy schedule has graced and honored this function with his inspirational thoughts and words of wisdom. Thank you, sir, once again. We are grateful to our respected director, Dr. Geeta Kakodkar, for her constant support and encouraging words. We will sustain our efforts, madam. Thank you once again. My special thanks to our madam, our OSD, to Honorable Health Minister, Dr. Rajnanda Desai, for a vision towards achieving malaria elimination goals